Thank you. So thank you very much for letting us come to talk to you. It's very exciting. Just to give you a little bit of background. I'm Douglas. I used to run a talking therapy service when they first started years and years ago when no one really knew what they were doing. Sam, who's with me today, was one of the first PWPs and ended up being a senior PWP and then teaching on a PWP role in adult services. So we come with quite a lot of years of knowledge of how you develop primary care mental health, and we've always thought that working within schools and the role that you guys are doing is fundamental to changing the way mental health services are delivered in this country. So it's really exciting to be here. What I'm going to do is just quickly give you a brief understanding of what we see SilverCloud as doing within services. And we see ourselves as part of the toolkit of delivery within services. So originally, when we first started in adult land, all doing manualized CBT, delivering PWP, HIW, in a very structured way in services. And we very quickly worked out that, like, for one thing, the amount of homework that's done, the amount of psychoeducation that's needed. There was one point where I was spending more on stamps than I was on a single staff member. We were sending post out the whole time. And what we saw very quickly was the engagement. There were a group of people that needed to engage in a much more digital way, and having the ability to send psychoeducation to people directly and then work on their phones. And remember, it's so old now that phones weren't that used very much. Now they're everywhere. So we saw in SilverCloud a real opportunity to, and this was pre me, they're using the new digital world as a way of engaging with people in the CBT methodology. And what that allowed you to do is in traditionally the PWPs and HIWs and yourselves would see someone for a certain amount of time each week, every week. And what you could see in the data, and I'm being a boring data person, was that actually presentation, people would DNA, people would get there quickly. We wouldn't have the level of engagement that you would think you would have in a traditional service. Not everyone gets to 90 sessions week after week. And when we dug into it, what we could see with people was it was very much based on people were fine. This was a light touch intervention. They went to see the PWP, they got the bit that they needed, and then they were off. And then they didn't really want us to keep chasing them down to get them to come to the next session. So DNA was quite high. Another bit of feedback was, I can't always make the same time each week. I've got a very difficult life. I've got children to look after. I've got all this to work on. And it was a real challenge for them. So what SilverCloud tried to do was to try and unpick this a little bit by creating what's called an asynchronous system of being able to allow someone. So if I take you through here, so you would sign someone up. So I would see someone, I would say, hi, how are you doing? Yeah, you're suitable for SilverCloud. We would sign you up. You'd then go on and do the activation component, you do the outcome measures, and then we would have bi-weekly or weekly meetings online around the way someone's working. So someone wander off, go do their bit of work, come back, go onto the system, write in how they're doing, use the mood diary or the worry part, or do some behavior activation, and then feed that back. As a practitioner, you then log in and you see what's going on for the person, and you can then escalate them up or send them to different bits of the program so that they can get a better understanding of what's going on. And it allowed you to work a bit more distant from the individual and around their lives. And we're not saying that this is for everyone. This is a toolkit that can be used within what you deliver. So what's happened since then is this has become really well established. And instead of having to send out books to people or do homework, you can actually see what they're doing on the phone. And you can see that they're actually doing the homework and doing the scores, and you get that information back. The other component of SilverCloud is we are really embedded in the case management systems that are out there. So if you're using IAPTUS or you're using PCMIS or you're using Rio, the system can be set up. So from a clinical point of view, you are not having to cut and paste and move stuff around. It all sucks in. So that's the structure. And from that, what we cascade down is different programs for different presentations. So next page. So we have a collection of programs that follow the NICE guidance. So we have an anxiety program and a low mood program for young people. And the idea here is being able to give people the psychoeducation and do it in a different context from what you're traditionally doing. Like everyone's talked about previously, there are different ways of working and different ways of being. And this is one to add to it. So we've designed these programs with some services in the north, and they are for 15 plus population, but that's basically around an assessment of people's ability. And just to give you an understanding of the kind of stuff that's in them, so we have space from anxiety, space from low mood, and then we have a collected one together, low mood and anxiety. And as you can see, these are the different components of the NICE protocols that you'll be doing. And then we have these unlockable modules that sit across the whole piece as well. So things like spotting thoughts, challenging thoughts, managing worry. And they're done in a very, very dynamic way that you can fill forms in and everything like that. So it helps. It also, the program allows you to structure things so that if people present with other components that get in the way of what you're doing. So if you're trying to deal with depression, but someone is struggling with, say, for instance, managing exam stress, and at certain times a year, that will be a big thing. So we have a module in there that you can tailor for the individual, friends and social groups, getting active and eating well. So lots of different ways of presenting the program. The other component is that we are part of the NICE evaluation. The program is currently being reviewed by NICE in the second phase, so it is completely fine to use and it follows the protocols that you would have been taught in your training. And the other thing is that we built some supporting. So what we find from the clinicians that they say we need stuff for parents as well and carers who are looking after these young people. So we've designed some additional programs. So supporting an anxious teen and anxious child had to be two separate ones. So that's another program that we have as well. And again, that covers the kind of things that you would be expecting to see within the program. The other part is that the platform allows you to print off and do things together with the child. So it's kind of a more interactive component. So that's done very well. The other bit to think is that we've also today, quite pertinent, we have looked at neurodiversity. We've worked with a group in Devon, adult and ADHD team, autism team, and with North Point CYP to build some more programs for neurodiversity. And again, these are the kind of things that we're doing. It's designed to help people. It's less of a treatment program and more of a strategies that allow you to adapt to your presenting issues. So for instance, if you are struggling with getting organized, so you don't have to have a diagnosis. It's not a treatment, as we've said earlier, of ADHD or autism. It's helping people understand. Yeah, thank you. And then we have one for supporting a child with ADHD, so the parents can also do this as well. And then living well with an autistic person and teen, and then supporting an autistic child. And as you can see, the kind of presentation that's in there. So just to give you, so they're the programs that are currently in Living Well with an Autistic Teen. It's just been launched December 2025. So that's there. So we have some other programs that are going to come along, and these are ones that have been suggested to us by services. So supporting an autistic teen and supporting an autistic child, Living Well as a teen with ADHD, and supporting a teen with ADHD will be coming along in the current year. So that's quite exciting for us, being able to not only deliver the programs that are around depression, anxiety, which is the component that is the main component of the delivery mechanism, but also those programs that are allowing you to deal with the neurodivergent things that you're presented with. The other thing just to say is that this isn't new. We've been around for a long time, and so we have the North Point is one of the services that use us hugely, and they find it really valuable. I think one of the best examples was a young person who had school excluded and was in their house, was never leaving, and they were able to get them to use the program and develop a way of getting that person back out and back into school. So it does allow you to have another tool in your toolkit to be able to do something slightly different. The other thing is it actually working towards the national priorities for digital interventions, and so the NHS and the national government are looking to reduce the burden and improve access through use of digital. So we are part of that process, and we're more than happy to help. The other thing just to say is that at the break we'll be able to do some demos, because it's quite challenging to do this, and you can come and ask us more in-depth conversations. Oh, there we go.